We are excited to present to you tonight a cycle of culture change, rekindling the joy of practice with lifestyle medicine. And that didn't work, so we got to get our mouse over here. I swear this is going to, there we go, perfect. Okay, so this is from Monday at the Rochester Democratic Chronicle, a local paper. Patients could face service cuts at upstate New York hospitals as costs skyrocket. And this is from that article. This is about hospitals in upstate New York. Nearly 90% of the hospitals reported negative or razor-thin operating margins, leaving them on track to end 2022 with millions of dollars in operating losses. Of those hospitals, about 30 sites faced potential losses of at least 2%. Potential losses exceeded 10% for about 10 hospitals as staffing shortages in part fueled operating struggles and budget deficits. The hospital spending on contingent staffing, such as travel nurses, has spiked about 50% from last year. And by the end of 2022, the group's 52 overall hospitals are projected to spend more than $1.2 billion on contingent staffing. By the way, as you all know, we spend a lot of money on healthcare in this country. And this is a graph that's a little complicated to understand, so I'm going to walk you through it. That's how much we spend on healthcare in the United States, almost $9,000 per person per year. And that's our life expectancy over there, about 79 years. Which, as you all know, this is from 2015, so that's actually come down a little bit because of COVID. But those are countries that spend a lot less than we do on healthcare and have a much higher life expectancy, significantly higher life expectancy. So we're getting worse outcomes even though we're spending more. This is from the New York Times today. Physician burnout has reached distressing levels, new research finds. Nearly 2/3 of doctors are experiencing at least one symptom of burnout, a huge increase from before the pandemic, but the situation is not irreparable, researchers say. Some of you may have heard about this. This is the Maslach Burnout Inventory, first published in 1981. It measures burnout on 3 dimensions: emotional exhaustion, depersonalization from work, and sense of personal ineffectiveness and lack of accomplishment. Doctors' dissatisfaction with their work could be caused by an incongruence between what they cared about and what they were incentivized to do by the healthcare system. And then this physician goes on to say that all the solutions run through a common pathway. They connect people with their most meaningful activities. So what if we could change the culture of medicine? Obviously, we're dealing with a problem right now. Medicine is not a happy culture. A lot of us are experiencing burnout. So magically, we wrote a paper about this. It's called First to Clinicians, a framework for culture change in a metropolitan medical community. And that metropolitan medical community that we're talking about is the Rochester, New York area. And we had that published in last December in a supplement to the Journal of Family Practice. And this is what we hypothesized. We hypothesized that a 2-part program that first educated clinicians in whole food plant-based nutrition and then invited them to refer patients to our 15-day whole food plant-based jumpstart program would, 1, increase clinician confidence in their understanding of optimal nutrition for health. 2, increase the likelihood that clinicians would counsel patients about nutrition. 3, improve patient health. And 4, increase joy of practice. We did get a grant from AHP, Accountable Health Partners, for $48,000. And the grant provided funding for participation in 2 previously established programs. We already had these programs available. And up to 40 clinicians were able to take the 6-week course on the benefits of a whole food plant-based diet. And then each clinician was able to enroll 5 of their patients in the 15-day whole food plant-based jumpstart program. And that 6-week course had been a course that we had been teaching in Rochester since about 2011. Almost 900 people have taken the course. About 15% have taken it for professional credit. And then the 15-day jumpstart is something we started back in 2018. And this is just from our website at the time, working with Accountable Health Partners and about Rochester Lifestyle Medicine Institute, working to make lifestyle medicine the standard of care. So this was the cycle of culture change that we envisioned, that number 1 at the top, clinicians would take our course, which at the time was called Eating for Happiness and Health. And since now that it's online, we call it Jumpstarting Health. But they then make these personal changes because they've learned about whole food plant-based nutrition. They then counsel their patients about nutrition, and they ask them to come take the 15-day jumpstart. And then these patients have great changes. They go back to the clinicians who are excited along with their patients, and then they send more patients to the 15-day jumpstart. And number 7, they tell other clinicians. and then the cycle starts over. So what we're trying to do is create a positive feedback loop. Hopefully this will be a feedback loop that will get out of control in a good way. So what about the patients? How well did they do in the 15-day program? So these are results that we typically see from our patients. Weight loss for people whose BMI is greater than 30. In 2 weeks, they lose over 7 pounds. For the average weight loss was 5.8 pounds. Systolic blood pressure, for those with a blood pressure over 140 at the beginning, they lost almost 17 points. Total cholesterol, a drop of 44 points for those whose cholesterol was over 200 when they started. Just a little point I always like to make is that our record drop in cholesterol in 2 weeks was actually 150 points. A woman whose total cholesterol was 299 on day 1, on day 15 it was 149. LDL cholesterol, if your LDL starts out over 100, you're on average going to see a drop of 33 points. And then fasting glucose, on average, for people who are in the diabetic range, is an average of 28 points drop. What about the clinicians who took the course? Well, I'm assuming that they also had some health benefits, but they definitely improved their diet. So at the beginning, you can see the dark blue is where they started the course. Most of them were on what they called a healthy American diet. And then the light blue was at the end of the course after 6 weeks. You can see the biggest spike there is mostly whole food plant-based, and some were completely whole food plant-based. So significant improvement for about 98% of the clinicians, and improvement in their diet. And how did they feel about it? Well, there was a questionnaire that they filled out, and at the end of 3 months, and I talked to my patients more about the role of nutrition after taking the course. 100% strongly agreed with that. I counsel my patients about eating a whole food plant-based diet as a result of taking the course. 88% agreed with that. And most importantly, talking to patients about the role of nutrition in chronic disease makes my work more rewarding. 88% agreed with that. Talking to patients about a whole food plant-based diet makes my work more rewarding. 81%. And being able to refer my patients to the 15-day Jumpstart program makes my work more rewarding. 81%. So the summary of the article, number one, a program that uses the two-part approach of educating clinicians and providing an opportunity for patients to experience rapid health changes through changing their diet, provides a template for encouraging culture change by creating a feedback loop with multiple benefits. And these benefits include improved patient health and higher job satisfaction for clinicians. So we are changing the culture. In fact, lots of local doctors have become board certified in lifestyle medicine. This was back in 2017 when the first boards in lifestyle medicine were given out in Tucson, Arizona. A number of us were there. You can see there's actually, I think everybody who's in that picture is actually here tonight, which is kind of cool. There were 5 of us out of the 204 that became board certified, and I believe we're up to over 1,000 who are board certified in lifestyle medicine around the country now. And you can see there's Dr. Tom Roberts, Sandra Sarnowski Roberts, Susan Friedman, Kerry, Graff, and me. And as of September 2022, the Rochester area is up to 13 doctors and 3 advanced practice providers with lifestyle medicine boards, and a number of signed up for this year. Very excited about that. How else is lifestyle medicine growing? Well, this is a graph that shows the growth of the American College of Lifestyle Medicine. You can see over there in 2010, which is basically when I joined. It was a few years old at that point, but I joined in 2010. We had about 132 members, and now we're over 8,000 members. So you can see this is a rapidly growing specialty. A lot of people are interested and excited. A lot of people understand that we really do need to help change the culture. So the behavioral changes needed are simple, and it could happen overnight, right? We're just asking people to eat better. And we're asking doctors to, talk to their patients about this. But can the system change? So that's the real question. Because there's so many sort of built-in parts to the system which really have a hard time adapting what we think is going to be beneficial in the long run. So that's the question. In the meantime, we can still have fun. So we are going to show you a little video here. For those of you out in the Zoom world, the audience just said, "Aw," and
If you suffer from the side effects of pharmaceutical commercials, including nausea, headache, vomiting, frequent trips to the pharmacy, or an overdrawn bank account, then WFPB may be right for you. Side effects for WFPB may include curing type 2 diabetes, reversing heart disease, weight loss, cholesterol reduction, easing of stress, lower blood pressure, reflux abatement, erectile function, clothing size reduction, regular bowel movements, smiles, vacations, good health, and children with puppies. Ask your doctor if WFPB is right for you. Whole foods, plant-based nutrition. Maybe our ancestors did know the secret to good health.
So nothing of any real positive social value has ever been achieved from the top down. It's always been achieved from the bottom up. Who said that? Howard Zinn in A People's History of the United States. So we are all about changing from the bottom up, and I think that's how it's going to have to work. And I have finished earlier than I expected, which is really good because we want to have a lively discussion. And I'm going to introduce our panelists. As you know, that's me, I'm the moderator. I'm board certified in lifestyle medicine as well as diagnostic and interventional radiology. I'm also founder and board chair and president of RLMI. And I'm a fellow of the American College of Lifestyle Medicine and former member of ACLM's board of directors. And I've been a partner with Borgardite Imaging where I've been working since 1986 in Rochester. So now I'm going to call up our panelists, and I'm going to, yeah, come on up, panelists. We're going to join me up here. Susan Friedman is board certified in geriatrics, internal medicine, and lifestyle medicine. She's a professor of medicine at the University of Rochester School of Medicine and Dentistry and founding director of lifestyle medicine at Highland Hospital's Department of Medicine. Dr. Friedman is RLMI's director of clinical studies. Have a seat, please. A member of the American College of Lifestyle Medicine Economic Research Consortium, and fellow of the American College of Lifestyle Medicine. She's also the author of more than 40 high-impact papers, which have been cited over 2,000 times. Dr. Kerry Graff, who's sitting down next to Dr. Friedman, is board certified in both family and lifestyle medicine. And she serves as lead lifestyle medicine physician for Rochester Regional Health in Western New York and works to integrate lifestyle medicine throughout this large healthcare system. She is the co-author of the 4-Leaf Guide to Vibrant Health, Using the Power of Food to Heal Ourselves and Our Planet. Is that working? Dr. Natasha Sodhi works at Rochester Regional Health, and Dr. Sodhi uses evidence-based lifestyle medicine strategies to prevent, treat, and reverse chronic diseases and focuses on incorporating stress-reducing techniques such as mindfulness, whole food plant-based nutrition, regular physical activity, restorative sleep, avoidance of risky substances, and positive social connections. She believes in collaborating closely with patients and emphasizes the connection between physical and emotional wellness. Dr. Sodhi is particularly passionate about women's health and supporting families in a multidisciplinary setting. Dr. Sodhi has personal experience with the benefits of lifestyle medicine and enjoys cycling, hiking, yoga, poetry, and cooking nutritious food for her family. And Allison Ogawa is a medical student in Rochester, and she's currently pursuing a Medical Humanities Fellowship between her 3rd and 4th years of medical school, researching the experiences of LGBTQ+ older adults living in New Mexico during the COVID-19 pandemic, and exploring themes of community, healing, resilience, housing, autonomy, and quality of life. Allison graduated from Amherst College in 2018 with a BA in sociology. She is passionate about health justice and curious about how we can provide better care for older adult populations, especially through the disease reversal and prevention lens. So welcome, panelists. We have to remember to turn the microphones on. That one's going to go on. This one goes up here. Okay. Yeah, here we go. Okay.
Want me to help you with that? You got it.
I think we're good. Actually, we're going to stop sharing right now because.
Yep, bring it to the last slide. Stop share.
All right.
And stop share on the left and right.
Oh, stop sharing.
Stop share.
Okay, perfect.
There we go.
All right, sounds good. So I want to start with Dr. Graff. Because we're each gonna have 5 minutes, okay, to talk about, maybe another, I think I ended early, that's good. Got extra time. Dr. Graff, could you just give a 5-minute introduction to what your connection with lifestyle medicine is and your views on changing the culture?
Sure, I think Ted asked me to talk because he wants to rub it in that I first heard about the health benefits of plant-based nutrition back in 1997 from Ted when I first moved to Canandaigua. It was my first job out of residency, and he happened to be the director of radiology at the time down in Thompson Health, FF Thompson Hospital. And I that was back in the day when you actually had to go to the radiology department to look at a film, and I went down to look at a patient's film, and I was in his office while he's going through it with me, and I said, I don't know how we got on the topic of it. Did you have pictures of food on your wall or something? Something.
Everybody
like,
always looked at my lunchbox. That was the main thing.
Sparked the conversation. I can't remember what, but he's regaling me about all the wonders of plant-based nutrition, and I'm like, yeah, right. If there's anything to this, I would have learned about this in med school or residency, and since I hadn't, I was like, he must just be an animal rights nut job, and kind of ignored him. So, payback is a BITCH, and so after that, of course, I got all of these lifestyle-related health problems, and so 15 years after that, I finally, I had all kinds of issues. I had endometriosis, I had hypothyroidism and chronic reflux and constipation and depression and you name it, and I had it, prediabetes. And one night I had a blood sugar of 197 after eating some Chinese food, and I didn't even eat that much of it. I normally would have eaten more, so I was like, oh boy, that's not good. And my preteen kids at the time had shamed me into getting Netflix, that I was like the loser mom if I didn't at the time. So I ended up watching Forks Over Knives on Netflix that night after I got that 197. And I was like, wow, these guys are as crazy as that Ted Barnett dude. Right? So I kind of went on to this 3-month rampage of just reading everything I could find out. Are they really crazy? Are they onto something? And I did an N of 1, right? I put myself on the diet they talked about just to see what would happen. And all of my blood sugars prior to that were always in the pre-diabetic range. None of them were normal, none of them were diabetic, but they were all pre-diabetic range. But as soon as I went on that diet from the very next day, all normal, right? So it was even before I did lose 25 pounds over that 3 months without being hungry, which is the hugest plus of getting patients to do this, to eat this way, because you're not hungry and you lose weight without being hungry. It's really fabulous. But my sugars were normal, immediately. My reflux was gone. My energy was way better, and I wasn't depressed anymore. And my reflux was gone. It was like everything got so miraculously better that I was completely sold. And I didn't really have a plan to go into lifestyle medicine or even how I was going to do it in my practice. I did it for myself. And then patients just started, they saw me looking a lot better, and they started asking me, oh, doc, what do you look so good? How'd you lose weight? And I'd be like, well, I just started following a healthier diet, and it kind of just evolved over time. But one of the things that I haven't shared with many people was that prior to this all happening, I was really burned out. I was really not happy in practice, and it was because I spent all day just sticking my finger in the dike for people's chronic diseases. We just kept giving them more and more meds as they got sicker and sicker until they died, and it was demoralizing. I don't think any of us goes into medicine just to help people limp along pathetically, feeling lousy, spending all their money on drugs until they die. I was just really unhappy. And I was really thinking about going back and retraining and maybe doing palliative care, where I at least would have meaningful conversations and being able to at least make people comfortable on their way out. And so I just kind of fell into lifestyle medicine and ended up taking that path instead. So I think part of it for me in adopting it was that I physically felt so much better. But part of it was that then as I started bringing it back to patients, I started watching them get better, right? Instead of just having them you control things for a little bit and then the disease would get worse and you'd have to give another med or you'd increase the med again. People were getting off their meds and they were feeling so great. And there's nothing better than a patient who can't wait to come see you to tell you how great they're doing and give you a big hug. I mean, when's the last time somebody gave you a big hug because finally by the fourth blood pressure medicine they're controlled, right? They just don't. And that was just, it brought a whole lot of joy back into practice for me again. It's hard to do in the climate we have now, but it is worth it. It is so worth it because people really, it brings back everything that you cared about medicine for, right? It's a meaningful connection with people, and you give them their lives back. I mean, we don't do that when we just give them meds and control their sugars and their blood pressures.
Yeah, thank you for that. Brilliant. I think I'm going to call on Allison now, our medical student. I might have to bring the microphone a little closer.
Sounds good. Hello. I am so grateful to be here today, especially alongside many of my teachers. I am now a fourth-year med student. I'm applying into family medicine. And I came upon lifestyle medicine really purely by chance. I was listening to a talk on geriatrics by Dr. Friedman, and I was like, she's onto something, and sent her an email and was like, hey, can I spend a week with you? I have this weird week in my schedule. And I was a third-year medical student in 2020, and I was entering my life as a clinical being amidst crumbling infrastructure, amidst a whole lot of death, and a whole lot of burnout. And so I was kind of at a place looking around thinking, really, is this what I signed up for? Is this what this is? And so Dr. Friedman was wonderful enough to say, sure, hop into Jumpstart and let's talk and let's explore. And that 2-week period of Jumpstart and week with Dr. Friedman really changed my trajectory in medical school, and kind of personally with family. I think it helped. In that week, I saw patients who were healing and feeling better and getting better. And that was the first time in med school I'd ever seen that. By that point, I'd seen many people die and no one feel better. And so it was really refreshing and special in a way that made me think, I think that there's something to this. So I also eventually then kind of talked about it so much to my poor mother and sister that they were like, you know what, you talk about this all the time, maybe let's try it. And it has kind of started a whole shift in the way my family thinks about food, and the way my community back home in Albuquerque kind of functions. And so it's been really special, and I'm excited to be really starting to embark on my journey, and both continue learning from the wonderful folks who have shown me this, and also pursue a career where I'm able to help people find that healing sometimes.
Wow, thank you so much for that. Dr. Sodhi.
Gosh, how do you follow these two? It's just really wonderful to be up here with these great women, with such amazing thoughts and courage, to share their experiences. So when Ted said,
you don't have to be so close to the microphone.
Oh,
that's right.
Is this good?
Yeah, that's good. Don't bang.
No what?
Don't bang the table.
Don't bang the table. I'm a mother of 3 boys. I bang a lot.
Yeah.
An Indian mother of 3.
Sorry.
So, when I think about how is it that we embark on changing the culture of medicine, and I thought about myself. I thought a lot about the different spaces that I've occupied over the years. And so I was in family medicine for almost 30 years and holding different practices or being part of different practices, whether it be private or community health centers, which I really enjoyed and loved, working in urban areas or rural areas, working on both sides of the border in different systems, Canadian and American. And also trying to be a person, raising children and supporting parents and things of that nature. And I too, I think, hit a point of burnout, and I think my body expressed it through, migraines, which was kind of a familial predisposition, but really kind of came to becoming, quite interfering with who I wanted to be in my different roles. And so I was actually at a one-day conference in Naples with Trish Luck, and the topic was shame in medicine. And I remember it distinctly. I remember it as being a very intimate gathering of physicians and other providers sharing experiences of burnout, experiences of being shamed at different stages of their learning and their career. And who else happened to be there but Kerry Graff? So I guess Kerry was like what TED was for you. And I had paused in my career at that point. And it's interesting because now I use the notion of pausing a lot when I see patients. And so when I think about my own space and the space that I shared that day, Kerry came up to me and said, there might be something for you. How about I share a little bit about lifestyle medicine with you? And so I did the fast track.
You didn't wait the 15 years?
No.
Get sick and have
No, I think it
abdominal
was more like
operations.
5 months, and I just kind of, when I put my mind to something, and so I certified a couple, like in 2019, and simply said, my migraines have completely resolved. So that was certainly life-changing for me and my family, and it made me also reflect on those spaces that I held before and what I enjoyed about those spaces, having that opportunity and that honor and that privilege to hear people's stories and share, both difficult but also really exciting things that are happening in their life. Having the time to do that. So one of my first jobs was at a community health center outside of Toronto, and we were given so much time to spend with patients. And then when you work in urgent care and you have like barely 10 minutes to figure out a big problem, that was stressful. So now when I think about pausing and I think about space and I think about how do I connect my space in a meaningful way with a patient. And lately I've been saying a lot to patients, when you come and spend time here, I first of all say, this is your time, this is your consult. And so now I only do lifestyle medicine consults. I actually left primary care, and this is what I do exclusively. But I'm really cognizant of the fact that they have to go back and live their life, that they've taken maybe an hour of time, which I put under the heading of self-care, maybe some self-compassion, to really come and talk about their life and lifestyle without the conversation on medications or imaging. It's really very much on the side, but we really talk about the 6 pillars of lifestyle medicine. And I shared that space with them, having kind of nurtured my own resilience over the years and adopting, whole food plant-based nutrition. And also, being respectful of the fact that they're coming and sharing with me again, just as my patients did 30 years ago. But my perspective is a little bit different in that I kind of look at it as, as a space in which lifestyle medicine can be used to nurture their resilience and their sense of confidence to be able to have some control over these conditions that have either resulted due to lifestyle or due to genetics, but that they do not have to resign themselves to only a prescription. Perhaps a prescription is still necessary, but that there is still some control in their hands, that there is still some purpose for them to carry out and play out in how this issue for them unfolds. And I think that when we honor and we value patients' ability through collaboration, through cooperation, through partnership, and while I don't certainly share my life with my patients, I think there's a humanity that is shared, where the relationship is different than perhaps that traditional relationship. And I think that, you know, I do, my mentors are here for mindfulness, and I find that it has grounded me so much, because one of the principles of mindfulness is the beginner's mind and being curious. And so despite having many years of experience with patients of different issues, if I come to a visit and I come to that space with that beginner's mind, that curiosity, and allow that space to unfold, that's how change happens, right? So change happens with that patient. Change happens when that patient leaves, and kind of leaves with maybe a sense of optimism and hope. And then perhaps when I collaborate with other physicians or their primary or their specialists, and I say, let's maybe take a different approach and collaborate how we can kind of nurture this patient's resilience. That's how I see change happening in terms of our own mindset, in terms of caring for ourselves, but also how we connect with our patients and connect with all the people that they are connected with.
Thank you, that was beautiful. Yeah. Dr. Friedman.
Oh, boy.
The follow-up act.
Yeah, I know, it's tough. So I'm a geriatrician by training, and I think there's a quote that I keep coming back to, which is by Paul Batelden, from the Institute of Healthcare Innovation, and he said that a system is perfectly designed to get the outcomes that it gets. And so when we think about where we're at right now, we have created this system that is incredibly expensive, that has led to the highest levels of burnout of providers across disciplines, and that has led, as Dr. Barnett showed, has led to really pretty mediocre outcomes, whether you're measuring longevity or prevalence of chronic disease. And so, the corollary to that is that if you want to have different outcomes, you've got to change the system. And so I have kind of approached this from a geriatrics lens, that, we look at things like multimorbidity or, presence of multiple chronic conditions. We look at functional impairment and cognitive impairment, and we look at quality of life, and a lot of those kind of more difficult to assess kind of things that you were talking about just now. Like others have expressed, I think I was beginning to feel like I was just sort of churning the wheels of a machine and not really doing things that truly impacted the quality of life of my patients. And at the same time, I was noticing that, so I had been in practice at that point for about 2 decades. I'm starting to measure my practice time in decades at this point. And so, and what I had noticed was when I started out seeing patients, I was seeing them, 80-year-olds, 90-year-olds. And as time went on, I was seeing 70-year-olds, 60-year-olds, 50-year-olds, even younger, with all of these kind of chronic conditions that we associate with aging. And I thought, what has changed in the 20 years that I'd been practicing at that point? And came to realize that it was really lifestyle. And I had 2 wonderful things happen at that point. One was that I took Ted's course and learned all about the power of plant-based nutrition, and which was really reinforced by Carol, his wife, who brought recipes and samples of food that really demonstrated that you could eat healthily and eat well at the same time. That was really important to me. And then the second thing was that I met Dr. Graff, who told me that lifestyle medicine was a thing. And I didn't know about it. And she said, you've got to go to the American College of Lifestyle Medicine meeting and go to the nutrition meeting. And I have to say that all of that was truly life-changing. And so I started to, I started a fledgling practice, consultative practice in the hospital. And I started to work for Rochester Lifestyle Medicine as the medical director there while we were seeing patients, and then more recently moved over to Highland Hospital. You know, one of the things that was really humbling in seeing patients on the inpatient side was just a lot of the kind of life misery that people deal with. You know, there is so much of it, and you know, we think about lifestyle medicine as addressing the root causes. So, you know, feet, forks, fingers, sleep, stress, love, right? But underlying that are all of these social determinants of health that we're just beginning to really give some space to, and it's such a critical thing, because where you live, how far you got in school, what you've had to deal with in terms of racism all your life, what your family income is like, if you can walk on a safe street and not worry about being shot, you know, it all, you know, whether you have a grocery store in your neighborhood that has good fresh food, and if you have more grocery stores than fast food restaurants, you know, all of that makes such a huge difference in terms of the ability to make changes. And so, as has already been expressed, I mean, having the time and space to sit down with a patient and kind of untangle all of those different facets is really critical if we're ever going to make any impact on their lives. And so I think time is so precious, and it's not a commodity that has been built into our system at this point. And I feel incredibly lucky that in designing my consultative practice that I've been able to say, I'm taking an hour and a half with my patients. You know, I'm going to spend that time to learn who they are and to understand what their goals are, what moves them and makes them want to change. And so it's been, you know, Ted talked about the three different components of burnout, but this idea of being able to have an actual impact on people's lives, I think that's something that lifestyle medicine really provides, which is wonderful. So that's sort of my meandering story.
Yeah, thank you. Did you want to talk about, you had an epiphany as well, right?
So I had a, yes, thank you. I had a 3-part epiphany over the past few days. So I cover the floors. I'm on service a weekend a month, and this past weekend was my weekend. And so I was running around seeing patients. I signed out sort of mid-afternoon on Sunday, and Sunday night started the Jewish New Year. And being Jewish, it was a time, so the Jewish New Year is the beginning of a 10-day period of kind of reevaluating, you know, having an opportunity to step back and reevaluate kind of what has been going on in your life, whether, you know, if you've done things to hurt other people, trying to make amends for that. And it's also a time to unplug. And so I was, you know, I got home I turned off my phone for 48 hours. Instead of watching TV after dinner, I spent time with my family, just talking, having a time to really talk. We ate good food. We had extended family over. We went for walks, and a lot of the pillars of lifestyle medicine. And I looked at my Fitbit when it was all over, and I saw that my sleep score was the best it's been in a couple months. And so, I felt so much better. And so that's epiphany number one, is that this stuff works. And I think it's not necessary to do it in a religious way. But it is important to take time, I think, for ourselves. And whether it's, 2 days may seem like, oh my gosh, I could never do 2 days, but a day, to just unplug, spend time being with the people that you care about most, having, what we call quality time, to, again, eat good food, exercise, that kind of thing. It really does make a difference. And what we know from the literature is that when we practice these things, we share that with our patients, right? That we're more likely to counsel them about that. So that was epiphany number one. And not surprisingly, I think, having gone through this 48 hours, the next morning I woke up and I felt like, oh, I have another epiphany. And that epiphany was, I tend to get very frustrated with the state of things and thinking about, oh gosh, I have to build this clinical service, and then I should be adding more patients to who I'm seeing, and I need to be doing research and adding more educational opportunities, and on, doing more advocacy. And it wakes me up at night and it gets me up early in the morning. And I suddenly thought, it's sort of like trying to bail water out of a lake. And, you spend your day bailing and bailing and bailing. And at the end of the day, you look back at the lake and it looks exactly the same. And I think sometimes that's disheartening, And so I suddenly realized that I was looking at the wrong body of water, that instead of looking at the lake, I need to look at the buckets and realize what I'm doing on a day-to-day basis. And I think if we can appreciate the things that we are doing to move things forward, I think it gives us a sense of accomplishment, which is one of the things about well-being, one of those three pieces of well-being. So I told this to my husband, and he said, and so that was epiphany 2. His epiphany 3 was, he said, yes, that's right. But if you get a whole lot of people to bail, then maybe you can make a difference in that lake. So that's epiphany number 3.
Thank you for that. Yeah, so it's time to open it up for questions. If anybody in the audience here has questions, while you're, Beth has a microphone. I just want to read a few comments that we're getting in the chat here. First of all, this was after Dr. Graff told her story. Thank you for sharing your personal story. This is why lifestyle medicine is so powerful, our stories. And then someone else said, thank you so much for sharing. I relate to this so much. And then there's a longer comment, which I'll get to later if we have time. And then Dr. Janet Lemke says, I've been referring patients since my Jumpstart experience in January 2022. Can you comment on your vision for collaboration with lifestyle medicine physicians outside the Rochester area who may wish to help facilitate their patients' efforts with the Jumpstart program? So I didn't plant that question, but it's a great question, Dr. Lemke. Please get in touch with us. We have instituted a process now of back and forth communication with patients' physicians. If they give us permission to share results with you, then we will be sending you a formal letter, basically a consultation letter explaining that they did the Jumpstart and what their results were over the last couple of weeks. So, we encourage you to send as many patients as you can to our Jumpstart. That's what we do. We love reaching people that way. And as Dr. Friedman alluded to, that's what we do. We send out ripples. We're bailing with, we have more and more buckets, and the more we can reach people around the country and around the world, the more we can change the culture. So it may seem like an audacious mission, but that's our mission, is to change the culture.
Can I speak up for a second? So when I joined Rochester Regional 4 years ago as the lead lifestyle medicine physician, our vision was trying to retro train, trying to teach everybody who's in the health system, all the docs in the system, all the providers, a little bit about lifestyle medicine. So at least they get a little bit of this stuff that none of us learned in medical school or residency. And then identify the folks who had a particular interest and see if we could get them to go back and to get lifestyle medicine board certification so they could then work more intensely with patients. So we've done that, but the problem is that we've got such a shortage of primary care right now. Everybody's just drowning, just going crazy, just getting the basic stuff done, let alone spending extra time. And so we've really shifted kind of what we're doing at Rochester Regional. And I'm not working so much in outreach trying to get people to get the board certification, although I'll still do plenty of encouragement of that wherever I can, right? But it's really about how we can use other pieces, other programs, bigger programs, where we can outsource things. So I don't lead any classes in trying to get people to do an intense lifestyle change. I send them to TED, right? We send them to Jumpstart, because that's work I don't have to do, but it benefits my patients, right? So whenever we can use these other pieces that are available, like I used to run the LIFT program. It's a 10-week course that improves mood and well-being by 30%. I don't do that anymore. I send them all to RLMI because it's work I don't have to do, but it benefits my patients. So it's a way that you can, if you're able to let patients know this exists, it's going to help. And then you don't have to necessarily do it yourself. Let's leverage that, and especially now that RLMI is doing most of its stuff on video, right? So it's all on Zoom. So you don't even have to be locally located anymore. That was really like the idea 4 years ago when I joined Rochester Regional, was we're gonna have all these docs across the, I don't know, I think we're 11 counties back then when I started, we're more now, and have them throughout the whole system, because you'd have little hubs and people could go and you could have little groups at that office. I'm like, well, you don't need to do that anymore because telehealth just exploded. Mm-hmm. And so it gives us a lot of ability to turf things to someone else. And if it's less work for me, but benefits my patients, heck, let's do it. Oops, now I'm going to say the wrong thing, right?
That was emphatic. I like that. That's good. Oh, thanks for that. Yeah. Any comments from the audience? Yeah.
All right. Hi, I have a question. Well, comment, I would say. I'm Regina Smolik. I'm an ophthalmologist from University of Rochester, and I'm actually a wellness officer for ophthalmology department. And I took a Jumpstart about a year ago, and a big believer and proponent. And I would talk to my colleagues about it, and realizing that there's very little dent I can do. And I did a whole lecture to the whole staff, and there was a little bit of interest. But what I was thinking is, I wonder if you guys can take it a little bit further on the university level. Like, we have a wellness committee that meets once a month at 7 in the morning, and we talk. There's a wellness representative from each department, and we talk about, I would say, probably very relevant to burnout. Most of it is around EPIC and how it burns us out. But to me, it sounds like we're banging our head against the wall, because the EPIC is not going to change. We just have to adapt to it. What has to change is how people live their lives. And we have to start with the physicians. So I understand that the whole program, and I applaud you for that, trying to convert more primary care physicians to bring their patients and, you know, take time and, like you're saying, turf to where the resources are. But I think you're going to get a much more bang for your buck if we take it on the level of converting physicians, and it doesn't have to be primary care. You know, in ophthalmology, you know, you probably don't even count us as a doctors, but we do see a lot of diabetic patients, and we do very nasty things to them, like lasering their retina, that doesn't really do anything to their diabetes or the vision, as a matter of fact. But now I give them this Rochester lifestyle brochure and say, do me a favor, try it out. Because maybe you're gonna preserve your vision and you don't need to get this nasty laser or get glaucoma that's gonna make you blind. Mm-hmm. So just, you know, maybe as a physicians, we probably, it's great that we have this great idea to work with the patients, but I think it's very important to start working with us. If you convert more doctors, then it's gonna have a trickle effect.
I appreciate that. Thank you. Comments? Go ahead.
Well, just a comment on kind of an approach that I take with my patients, but also that I would take when I'm speaking with a colleague, and that, you know, lifestyle medicine isn't an all or nothing endeavor. And often I preface my visits with my patients saying that, you know, this is your visit, this is your time, and it's not about my agenda, it's about the health goals that you are setting for yourself and whether I can offer you information that might help you attain those goals. And I also try to explain that my purpose is not to try to convert them to 100% whole food plant-based or veganism, which are still different. Because some people come in at very different points on that spectrum of willingness to change. Some are still contemplating it. Some are just like desperate because they've had a catastrophic event happen in their life. But I will say that that kind of eases their anxiety about having to give up, you know, their daily meat or whatever. And it's a very slow transition. And, you know, as Sue mentioned, when you do a deep dive, I often go into a deep social history before I even talk about nutrition, so that I can understand how their day plays out. You know, where is their space? Where's their opportunity for a change? Where's their willingness for change? And I would suggest the same when you talk to physicians. Some people, even in our own profession, have a notion that it is an all or nothing thing, but it's not. It's really looking at opportunities within a patient's life to maybe look at some more self-care or look at eating an extra fruit or vegetable that day, and then experiencing the benefit of doing something meaningful for themselves. So I think that's also part of that message. When I agree with you that we need to kind of get everybody on board, but we have to kind of present it in a way that it can be a meaningful experience that still can be a personal experience for each patient and still have such a positive effect.
And my mantra for that is, eat as whole food plant-based as you're willing and able without making yourself and the people you love nuts, because nuts won't be sustainable. And that usually makes them laugh. And then it feels like, okay, if I'm gonna have my salmon once a month, who cares, right?
Go ahead, Allison.
And I think I'd also like to chime in that a big part of how I see like a future where where lifestyle medicine is kind of seeped into our medical structure is really dependent on us using this platform to think about the structural barriers that exist for ourselves, but mostly for, well, also in addition for patients. If you think about, like, even here locally in Rochester, if you think about food apartheid, like that is something that we have a platform and an ability to address. And that is like pretty core to making accessible a lot of what we're talking about for and how we counsel patients. And so I think I love the idea of, you know, how can we utilize our resources like the university to educate our physicians, but I also think it's how can we use those resources so that we can reduce barriers such that that conversation you have with a patient about, you know, what are the goals for you and what's meaning making for you, and walk me through what your day really does look like, we can really amplify the effects that we have in those conversations.
Any other comments about how to reach doctors?
I think it's a multi-layered kind of effort. I think there are things that are going on a national basis to try to change how we're doing things. The idea that the Jumpstart is not covered by insurance means that it is a barrier for a lot of patients. And we've been very fortunate that we have had grant funding to cover that, but for many of them. But it does become another roadblock among many in terms of making changes. So I think there are systemic changes that we make while we are making local changes and personal changes. So it's not not just one thing. It's I think multiple things that we have to be dealing with at once.
Thank you. We did have a question in the. We had a question from the chat about actually insurance and reimbursement and how lifestyle medicine is dealing with that. So I think you just touched on that, but do you have any more thoughts about?
The individual consults are covered by insurance. If you have commercial insurance and you have a body mass index over 25 with one other risk factor for heart disease, or a body mass index over 30 and you don't need any other risk factors for heart disease, it's covered with no copay, no deductible. That's huge for accessing because so many people have high deductible plans, and the visits are longer, so they're not cheap, and they're more frequent too. So even if somebody comes in to see me because they've got rheumatoid arthritis, if they meet their criteria based on body mass, I'll just tell people, you're going to see this first on your bills. The reason why, this is why, because I can get it for you for no copay, and because I'm not going to give them different advice anyway. It's going to be the same advice for both. But even if it's not, if they don't have commercial insurance, it's still covered by insurance. It just won't be covered with no copay, no deductible. So that's very inexpensive. It's the programs that aren't covered. Nope. That's part of that's part of the under the Affordable Care Act, actually. So as part of the Affordable Care Act, it mandated that all A and B recommendations from the U.S. Preventative Services Task Force, so like mammograms or colonoscopies, they're all covered with no copay, no deductible, right? And a program for folks that are at risk for heart disease, an intensive lifestyle medicine program for folks at risk for heart disease is covered. So it doesn't mean that there aren't folks that, you'll have an autoimmune patient who's got a body mass index of 23 who would definitely benefit from lifestyle medicine. They're not covered with no copay, no deductible. It doesn't mean don't send them to me. They're covered like regular insurance. But we can access the no fees for a lot of folks. And we'll always try to do that, even if it's not the primary reason they came in.
I would just add that in the meeting with that, so thank you for clarifying it. To the point of the lady behind me that spoke, that we do really need to start with physicians, right, with providers, because so many patients, myself included, will take my provider's advice and recommendations, right, to do A, B, or C. And I really think that is critical. I do want to commend you, Dr. I won't say Bennett, I don't know why. Dr. Veggie.
Thank you. By the way, this is Lucia, who's the executive director of the Monroe County Medical Society. And if she forgets my name again.
Yes, thank you. That's
I've been a
important,
member
right?
since
Oh, thank
1986,
you.
but that's
Thanks, Beth. Now I don't have to feel like I'm yelling at my kids. I do want to thank you and commend you and your team for the work that you're doing, and I'm 150% behind it. I also took the Jumpstart program for 2 weeks and found incredible benefits to it. So I think that for me, it's also personal, and that I very much can testify to the benefits of it. To the comment that was made by the young lady behind me as far as engaging with providers, I'm really pleased as the CEO of the Medical Society, and Dr. Graff is our co-chair of our Physician Wellness Committee, to be in conversations and discussions with RLMI about how do we go about engaging and training more providers. So the I think the key is that, and the other piece of it is, when I think about, and a question for all of you as lifestyle medicine practitioners, is how do you break through with your patients some of those cultural barriers? So when we talk about social determinants of health, when we talk about even culture just in general, how does one, as a Caucasian physician, really address the needs of a Latina or an African American who has been brainwashed and ingrained that the only way to eat is your rice and beans, of course, is healthy if it's brown rice, right, and our beans, but fried foods. How do you break through as lifestyle practitioners the cultural barriers that have been ingrained in us for years and years and years? So that's a question. But in addition to that, I would say that I'm pleased to hear that this is starting to be covered through the Affordable Care Act, because many ethnic populations, many indigent and underserved populations don't have access to this level of care. I'm fortunate that I can do what I did and go through the program, but many others behind me don't have that same benefit.
Just clarify, it's the individual consultation stuff that's covered well. The group programming is not. That really needs to change. So hopefully we'll have some leverage with the insurance companies going forward, and that will get better, especially because people make behavioral change best in community, right? So if we can do more group-related things, it should help people make more progress.
Yeah.
So this might not answer your question completely, but it's just one of the things that I do when I see people is I do take time to explore their metacognition and also their use of technology. So it's actually part of my template. And so we spend time exploring, first of all, their education, formal or informal, things that they are good at, things that give them joy, and how they learn best. And so I use that information to then think about the educational resources that I have on hand. And then when I go through the list of resources that I have, then I bold ones that I think might be of use to them based on that information. And then with technology, I do a deep dive in that as well to understand how they use technology, how it's part of their life, whether they would be interested in using that to learn more. Because again, I actually articulate the fact that this is just an hour and a half of time we're spending together. But then there has to be a learning and a willingness to learn. And so then I use the different avenues that they might have based on those two areas to try to help them educate. And some people love to read literature, some people want to go on social media. And so whatever that works for them is the door that I try to kind of creep open to introduce lifestyle medicine to them.
Thank you. I would just add, other than that, Ted, I think you already know this, but other than being the CEO for the Medical Society, we are already very actively engaged with RLMI. But the other piece of this I would offer up is my other role as Executive Director for the American Academy of Pediatrics. For New York, Chapter 1 is looking at ways to engage pediatricians. In my conversation with, forgot her name already, but right here to my left, the one you hugged, in my conversation with her, the whole idea of really teaching and training pediatricians to actively teach the parents of the younger generation coming up, starting to kind of ingrain this thinking of lifestyle medicine and this journey, even at that stage and that level. Thank you.
So just as usual, just as the conversation's getting good, we're running out of time, but I'm going to make an executive decision. We have another question in the audience here. And
Hi, Mick Krasner, primary care internist here. I first want to just comment, isn't it interesting how easy we just feel like it's totally natural that a wellness committee would have people meet at 7 o'clock in the morning? I wonder, how many of them got a good night's sleep? How many ate a nutritious breakfast or exercise perhaps in the morning? So that's systemic and structural. My question was really related to this conversation. Among the most vulnerable populations, those that are really affected and carry the biggest and largest burdens of chronic disease and the sequelae of chronic disease. What, do you have a vision or a program already in place about how to really engage those communities? Because I think they're also very marginalized from regular healthcare.
Interesting question. So, Susan, you want to?
Yeah, I mean, again, this is going back to the vision of the lake, right? I think sometimes it's quite overwhelming, and so what we've done at RLMI is done a couple of different pilot projects to try to answer those questions. You know, one was with a deaf and hard of hearing community, where there were all sorts of things that were changed about the program. So, you know,
This was on Zoom, by the way.
It was on,
yeah.
on Zoom.
Go ahead.
So closed captioning, the person who facilitated it was fluent in sign language. There were some, Ted, you probably know a lot more about all the adjustments that were done, but multiple different adjustments to try to both reach out to that community across the country, and then you know, to provide an intervention that would work for them. And then another group that we've worked with is an African American church group, actually a group of churches in the Illinois community. And part of that was driven by an individual nurse practitioner who went through the Jumpstart program and said, you know, my community really needs this. And she was really a change agent in her community. And I think, you know, when we think about these ripple effects, you know, I think it's important to remember that anyone that we interact with and talk to about these ideas can end up being a change agent and making a huge difference. And so, you know, I don't think it's something that any one of us is going to do, but it's something that we're all going to have to kind of chip away at this problem and in order to move forward.
Yeah, thank you for that. You know, we're going to have to unfortunately wrap it up. We have another event. We have food for everybody, and not for you in Zoom world, but we have a string quartet also waiting for you in the living room of the Academy of Medicine. So thank you all for coming. You will be out in anybody who's here or in the virtual world, you will be receiving an email with a survey. If you fill out the survey, you will receive a certificate with 1 CME of credit for attending tonight's program. So thank you very much. Thank you to the panel. And good night.